everyone, welcome back to my channel and to my last seminar discussion for this semester. And this one is going to revolve around disease prevention, specifically malaria. So I have a few aha moments that I wanted to talk about this week, some that really allowed me to see a more holistic picture of what it means to actually prevent disease, and a lot of the inconsistencies and complexities and nuances surrounding disease prevention. The first concept I really wanted to talk about was the malaria industrial complex, and the fact that a lot of developing countries are so focused on the prevention of malaria, and that almost turns a blind eye to a lot of other really important and serious diseases that sometimes also present like malaria in terms of febrile symptoms. So I thought it was really interesting to see that as much as it's built into the policies of a lot of these developing countries, this desire and need to address malaria as a particular component stems a lot from the agendas of developed countries. So I feel like there's still a lot of colonial practice and a lot of colonial influence when it comes to deciding what should be on a health agenda. And that translates really nicely into what happens when there is an overdiagnosis in a low prevalence area. There's problems like drug resistance, over-reporting. That kind of shifts the amount of money that's given into this particular area. There's questions of drug shortage. So for some particular region that is so low resource, having misuse of drugs is really critical and really serious to address. And then lots of money that's unnecessarily spent on these drugs, which is problematic for both an individual level in terms of financing their medical treatment, but also structural, more government level in terms of how much money they're actually putting into a system that's not really working for the people. And then my second aha moment has to do with those developed country perspectives that are placed on or enforced on, imposed on developing countries. So this view of malaria is this really, really serious thing that needs to be treated with the utmost attention, whereas those that are in endemic areas perceive it how we would perceive a cold. So that doesn't necessarily take away from the fact that malaria is a very serious illness, but rather local perceptions of it don't necessarily match with the amount of investment and I guess the strategy of investment that's taking place. So as much as investment is important, there needs to be some form of integrated and feasible and acceptable approach to malaria disease prevention. And so that relates really nicely to one quote I wanted to leave here for the video, is when you label something, it could have been there before, but when something is real, it becomes real in its consequences. So I think it's important as soon as we identify something as an issue, and as a true issue and a true representative value for a country. So not some statistic that represents an overestimation of a disease, but rather a true estimate of the disease. I think once we determine that something is a problem, there can kind of be a shift and more of a sincere examination of how to address the problem. I think that's going to require a lot of involvement on the local level, and is really going to require collaboration between northern and southern parties. I don't think that that's necessarily happening for a disease like malaria. And an example that I can leave you with is consideration of if you do have some form of financing or vertical approach to financing where a non-governmental organization or even a government organization is giving something like a rapid diagnostic test capacity to a lab or some form of instrument for the lab, and it's only being used for malaria because that's what was in the contract of receiving that. I think that it's really damaging for a developing community to have such a vertical view and lens imposed on them for disease prevention. I think there needs to be more of a diagonal or horizontal approach when it comes to how we talk about disease and how we implement strategies that are going to be sustainable and appropriate for the communities who are involved. So that's what I just wanted to talk about quickly today. This was like a really nice cap on a really wonderful semester of learning. So I thought I would keep it brief, but I'm really looking forward to some new learning in global health in the coming months and years, with my trip to Uganda for a global health internship, and hopefully some more academic studies into this area. But this course has been super formative for that, and I'm really thankful for this experience. So if you have any questions, feel free to leave them down below or reach out, and I'd love to have a conversation with you about some global health, and perhaps for this video, and in the context of this video, some discussion surrounding disease prevention activities. So take care and bye-bye.